Our next panelist is Danielle Legault. As a beneficiary attendant in a public CHSLD, Sister Danielle Legault became interested in union affairs and began her union career as a delegate in her institution. She then became a member of the local executive committee and served as an instructor for the SEIU 298. She became a member of the General Council in 1989 and was elected president of her division in October of 1993. In November of 1995, Sister Legault was elected corresponding secretary of the SEIU Local 298. She also headed different committees, including Beneficiary Attendance Committee, the Nursing Assistant Committee, and the Youth Committee. She is currently in charge of the committees on women's living and working conditions and the Social Delegates Network. Sister Legault also represents her union on the FGQ Committee on Women's Living and Working Conditions and SEIU Canada on the Board of Public Services International. She's a member of the Executive Committee of FORMAS, the Training Mutual for Workers in Private Sectors, Residents, and is very involved in Quebec's private residence and social economy sectors. Sister Legault was first female international vice president of SEIU for Quebec and has been in charge of the organizing department since 2006. Please join with me and welcome Sister Legault.
Alors, Monsieur le Président.
Chairperson, friends, delegates, brothers, sisters, I'm very happy to be with you this evening. I would like to thank my sister and friend Louise Inton, who thought of me, who invited me to come speak to you, to tell you something about the situation of home care in Quebec. I'm very happy and proud to share with you what's happening in Quebec. A few numbers, first of all, to understand the context. From 1986 to 2007, the population of Quebec went from 6.7 million to 7.7 million persons. Over the course of the same period, people 65 and over had been 658,000 to 1.1 million, an increase of 68%. According to the Statistics Institute of Quebec, if the trends continue in 30 years, the proportion of people 65 and over throughout the population will have doubled. So Quebec has an older population than Canada on the average. These are numbers that came out last July. The percentage of people 65 and over would be 15.7%. For the first time, people 65 and over, 1.25 million, would be greater than the number of people under 15 years of age, 1,241,000 in the province. So, the state of health of seniors, what's happening there? We know that nowadays people live longer and in better health. Good news. Life expectancy for women has gone from 79.7 years, from 85 to 87, to 82.9 years in 2006. For men, life expectancy went from 72 to 78 years of age. We're living longer and in better health. Thank goodness. However, we know that there are deficits, and chronic health problems increase with age, bring about handicaps and loss of function. Only 30% of people over 65 years of age and over require health linked to moderate or serious disabilities. However, after 65, the percentage increases to more than 40% and may even reach 70% among people over 85 years of age. So what are the needs for long-term care in Quebec? The increase in number of people who are seniors brings about greater demand for long-term health care, residential care. According to the National Institute, if we consider only the aging of the population, the number of persons having long-term health care needs should, in Quebec, double between now and 2031. In some regions, The numbers may even triple. However, these numbers, and we know this, we've been speaking with the government for some 10, 15, 20 years, these haven't presented our dear governments. This goes back a few years now with several governments to shut down beds. Thousands of beds have been shut down in long-term health care public institutions. Today, 7,200 people are waiting for a place in long-term residential care throughout Quebec. These are long-term health care residential centers. We use a lot of acronyms. We're used to that. Sometimes we forget that not everyone is familiar with our acronyms. So these beds have been closed, although demand is increasing. There are great pressures on alternative networks, of course. For example, private homes and intermediate resources. However, when making decisions, no one believed that those infrastructures could be ready to receive so many elderly people. There weren't enough places available. There wasn't the health care of proper quality or staff. In 2011, the Public Policy Institute published a study establishing that for-profit institutions are more likely to provide care of lower quality. That doesn't mean that all residences that are private provide poor care. Of course, however, being private, profit is necessary. So people may have less staff, take shortcuts. Food may be of lower quality. That's a way of making more profit. So, excuse me. Sorry. So, shelters for seniors are expanding in Quebec. There are private complexes opening their doors, offering a range of services. There could be living in apartments, semi-autonomous, with a small loss of autonomy. There may be services, a cafeteria, for instance. And then there's a phase where more services are required and ends up with the CHSLD, long-term care residence. There's Chartwell, for example, opening private residences. Long-term care facilities to keep the clientele. Apartments are offered. And even long-term care facility services are offered afterwards. So withdrawal of the state produces this. These people have to pay a lot for specialized services, which otherwise would be provided by the government. So the government has cut down on the number of beds in facilities. The private sector is taking over, but it's more expensive. So the poor do not have access to all the services made available by the private sector. What do seniors really want in Quebec and elsewhere in Canada? It's probably the same elsewhere. It's the first choice of the seniors is to remain in their own homes as long as they can. And even with that, some years ago, the government chose to enhance home care so that, in fact, the seniors could remain as long as possible in their own homes. Unfortunately, as we say in Quebec, they haven't walked the talk. Governments talk, but don't provide the funding and the support required for all of this to be done. There are now some 8,000 people on a waiting list to have home care. The population is increasing, 65 and over, but there's still people on waiting lists waiting for home care. We're not even talking of residents. The Quebec government boasts having budgets increased for home care to $534 million per year. And in the coming years, they say the budgets will increase by 200 million to offer services to 1,500 more people, of course. We're still waiting for the funding. However, the Ombudsman has confirmed in her last report that additional sums in home care are often redirected for budget cuts or to cover deficits in other services. So, we don't manage to get the necessary care. Home care in Quebec is provided by public bodies, in theory, or social economy enterprises. The social service community centers have health centers and services for communities. Community health centers, that's public. The community health centers to offer home care to persons who are losing their independence, persons requiring short-term care, hospitalization follow-ups, rehabilitation or palliative care. They receive these kinds of care through the public sector directly. In most instances, because we know that today community healthcare centers no longer are able to meet the need. There's enormous demand for home health care, domestic services, housekeeping, supervision, and community health centers no longer offer these services, given that the demand is too much for immediate short-term care services. More and more, even for people who need to have personal hygiene services, the community centers can no longer provide the necessary staff for that kind of service. So, people deal with social economy enterprises in the private sector. They're partly funded as well by the government in order to meet this deficit in services for the public. Seniors have to pay, of course, to benefit from the services of those companies. For example, financial waiver programs for people who come to help out at home. It's a financial waiver program that funds partially services. For instance, we may give up to $4 per hour for services for home assistance, housekeeping, supervision, laundry, errands, and so on, where there are set prices. But it always relates to the financial needs of the persons involved. Seniors, the most vulnerable persons who receive public services, OAS and GIS, can't always offer themselves these services. They can't afford them. We receive small old age pensions, so we can't afford to pay for outside services that are no longer provided by the government. What happens when services are no longer offered? Persons have to go to shelters, although the government's philosophy has been to try to maintain seniors in their homes as long as possible. This has another rather perverse effect. People who are no longer able to get assistance go to the hospital. They can't be sent back home, given the lack of services. They don't have the help required. They're given a bed, so that there's overcrowding in emergency wards because there are persons who should be at home or in residences or in long-term care facilities to receive some care. But given that the government has cut back on all those services, these people find themselves in hospitals and are using up short-term care beds that could help people in emergencies who also are waiting for medical care. Underfunding of social economy enterprises keeps companies in precarious situations. The government gave in 2010 urgent funding, emergency funding. Everyone was crying out. There was an enormous need. 15 million were dispersed to be able to continue offering services. No. They demanded 15 million. They received 3.5 million. And in 2009, the government had also promised funding of 15 million, but zero was spent. So social economy enterprises work with the same budget and have done so for the past 10 years. Even when they receive government funding, it's simply to cover the cost of living that's increasing. So products and services so on increase. Chronic underfunding of that sector harms seniors, of course. These companies have trouble maintaining steady services, and public services are transferring more and more demand, and waiting lists are lengthening constantly. I have to tell you something about the people who work in the sector. Home care workers. These people are relegated. This is simply cheap labor for the government. We're no longer hiring people, although services are required. So services are purchased in the private sector, and of course we know that community services, personal services, are never acknowledged as being valuable work. So those persons are paid salaries and have working conditions that are quite mediocre. Everything is based on funding. If there's no government funding, there will be no improvement in working conditions. So, however, these people are almost all, no one's perfect. People can't be perfect. But I can tell you that these people, I work with these people regularly. We meet with them, we talk with them, and their first concern is the care of persons. They give 150%. They do the maximum with few resources to ensure that people get the best services that they're entitled to receive. So the government is withdrawing from home care services. Community health centers are providing fewer services, counting on social economy enterprises that are underfunded chronically. So at the SEIU 298 in Quebec, what are we doing? Recently, we asked for a meeting with the Minister of Social Services, Dominique Vian, so that we could meet with her to properly explain what is happening in private residences, among others, but primarily in services for home care. I'm telling you, this is underfunded as a sector. No one wants to listen to us when we talk about this. It's as if, well, the public is not giving, the private has to make do, and it's often the community that takes over. These are social economy enterprises. It's the community that decides to take it on, to offer the public in the neighborhood necessary services. But it's not enough. It's too little. And we speak of statistics. I mentioned this earlier, where people 65 and over will double in the coming years. It is essential that the Ministry of Health and Social Services and persons in charge of seniors listen to what we have to say. Unions in the healthcare sector, we know what's happening. Of course, when they speak with entrepreneurs, owners, people who manage social economy enterprises, apart from saying that we need more funding, they don't really defend the interests of seniors and healthcare workers in the sector. That's why we're pushing to be able to speak to the minister to provide a realistic picture of the situation. We also want to tell the minister that the public network has to take itself in hand and provide the Quebec public with the services to which the public is entitled. When we end up with a situation that we see today in Quebec and in Canada, where seniors are more and more numerous, we have to change the way we think. We have to now consider that home care services must be an integral part of health insurance. It has to be part of the public plan. Things are not the way they were 50 or 60 or 100 years ago. Society's changed in general. People are working nowadays. It's very hard to remain at home without any support. So the government has to take this into account and provide the Quebec public with relevant services. And the private sector is not a solution to provide our seniors with access to shelter and services according to their needs and not according to their pocketbooks. Because that's how the government's been working. When it's downloaded to the private sector, those who can afford will pay for it. And the others, well, stand in line. We know what that produces. We've been seeing this for years. We're also demanding better funding for social economy enterprises, of course. And we're working closely. We support the CLC and FTQ campaign to improve public pension programs. If this is a trend that the governments will take, we have to be sure that the public will have the ability to pay, given the costs, to ensure services required and the ability to afford the services. If the government no longer wants to take this in hand, we at least must have the ability to pay for them ourselves, although our objective is to maintain quality service, public service for the entire public of Quebec, and seniors in particular, our seniors, to whom we're greatly indebted, because Quebec Health Insurance, all our plans that we have, our social programs, are thanks to them, the work that you've done. And we must ensure that these programs will continue and that we also will be able to benefit from them someday. So let's struggle together. Thank you very much for having listened to me.